His Majesty's loyal opposition, Shadow Minister Greg Stafford.
Thank you very much, Dr. Huck. It's a pleasure to serve under your chairmanship, and I'm extraordinarily grateful to my honourable friend for Mid-Bedfordshire, who has campaigned tirelessly for a GP surgery in Wixham's in his constituency, and I was delighted to hear that his campaigning is beginning to bear fruit, and I wish him well with that. But the same challenge that he mentioned resonates strongly in my own constituency of Farnham and Borden. Areas such as Borden, there's been significant housing growth, yet the supporting infrastructure, particularly primary care, has simply not kept pace. Residents move into new homes only to discover that securing a GP appointment is harder than it should be. Now, honourable members across the House have made a consistent and compelling case this afternoon. Rapid housing growth places real strain on local practices. Patients struggle to access timely appointments. Infrastructure funding is too often misaligned with development, and coordination between local authorities, NHS bodies and developers remains insufficient. Healthcare must arrive with these new homes, not years afterwards. Turning to the government's 10-year plan, which places care closer to home, as being part of the centre of NHS reform, I believe that ambition is entirely welcome. But as honourable members have raised, the Neighbourhood Health Implementation Programme begins with pilots in 43 areas, and each designated neighbourhood must serve a population of around 50,000 people. That population threshold presents a fundamental challenge for rural and semi-rural areas. Individual villages and market towns fall well below that figure. And while larger geographic regions may technically meet the requirement, genuinely rural communities cannot qualify as standalone neighbourhoods and are therefore excluded from this first phase and indeed potentially always. And if this 50,000 is rigidly applied, smaller communities will only ever be served indirectly, folded into large neighbourhoods covering multiple dispersed settlements. That risks diluting focus on their particular needs, and residents may continue to face those long travel times, limited access to primary care and fewer coordinated services that honourable members have described. And this is especially concerning given the demographic trends. Healthwatch England highlighted in 2023 that the NHS long-term workforce plan projects a 55% increase in the number of people aged over 85 living in rural areas by 2037. Demand is rising most sharply in precisely those areas excluded from the pilot phase. In areas like mine, where hospital access already involves significant travel, the case for strong, well-resourced local primary and community care is self-evident. Excluding rural and semi-rural constituencies from these first waves risks entrenching disparities rather than reducing them. I have also concerns about cuts and mergers in ICBs. The institutional knowledge and expertise built over many years is risks being disrupted during this transition. In my area, Frimley Integrated Care Board, which serves the northern part of my constituency, is being abolished. The local leadership and coordination that previously existed will be lost, and responsibilities will be redistributed. Change on this scale requires clarity. Clarity of governance, clarity of funding, clarity of accountability. And without it, delivery will vary and confidence will suffer. Now, access to primary care, pharmacy and dentistry remains central to this debate, particularly in rural and underserved communities. Since 2024, more than 200 pharmacies have closed in England. In the first 3 months of 2025 alone, 31 medium-sized and 24 large pharmacy branches closed. For villages and small towns, the local pharmacy is not a luxury, it's a frontline health service. And whilst schemes like the Pharmacy Access Scheme and the Pharmacy First Scheme are supported and welcome, there are significant problems for their rollout, as highlighted by my honourable friend, the member for the Weald Kent, when unions like the BMA try to undermine that very significant investment. So I have a number of questions for the Minister, Dr. Huck. For rural and semi-rural constituencies such as mine, the details of these policies matter enormously. So first, will the 50,000 population threshold be applied flexibly in rural and semi-rural areas? If so, how will smaller communities be guaranteed equal access to neighbourhood services? Secondly, what is the timetable for expanding the scheme beyond the initial 43 pilot areas, and when can constituencies such as mine and that of the honourable member for Mid-Bedfordshire expect inclusion? Thirdly, how will continuity of neighbourhood health delivery be safeguarded during the merger and abolition of ICBs? and who will ultimately be accountable for that if implementation falters? And finally, will the Minister publish clear and measurable criteria for success, particularly in relation to rural access, travel times and coverage of elderly populations, so that this House can judge whether care closer to home is being delivered in practice, not just merely a promise?